Have you ever had a patient tell you, I feel okay at home, but the second I walk into a grocery store, I get dizzy, foggy, nauseated, or overwhelmed? This is one of the most common real-world complaints I hear after a concussion. And clinically, it can be easy to underestimate because the patient may look fine in a quiet treatment room. Their balance testing may not look terrible. Their eye movements may be improving. Their symptoms may even be lower at rest. But then they walk into a grocery store, a department store, a school hallway, gym, or crowded event, and everything ramps up. So the question is, what is actually happening? A major piece of this is often visual motion sensitivity. After a concussion, the brain may struggle to efficiently process visual motion and busy sensory environments. A grocery store is not just walking through a store. It is shelves full of patterns, bright lights, people moving in the background, carts passing by, signs overhead, sounds from multiple directions, and constant head and eye movement as the person scans for items. This is a very different sensory load than sitting in a quiet bedroom or walking down a calm hallway. A simple way to explain this to patients is that the brain is processing backlog. After the injury, it may not process visual, vestibular, auditory, and cognitive information as efficiently as before. When too much information comes in at once, symptoms increase. But as clinicians, we also need to avoid oversimplifying this. Not every patient who gets dizzy in a store has only visual motion sensitivity. We need to think of it in systems. Could there be a vestibular involvement? Is there gaze instability or motion provocation with VOR testing? Is there oculomotor involvement? With scanning shelves or changing focus triggers, do these trigger your symptoms? Is there autonomic intolerance, where walking through the store increases heart rate and symptom load? The key is not to guess, the key is to evaluate. For these patients, the clinical goal is to identify their current sensory threshold. How much visual and sensory input can they tolerate before symptoms rise? Can they handle 2 minutes in a busy environment? 5 minutes? 15? Can they tolerate a small store but not a big box store? Can they walk through quiet aisles but not crowded ones? Once you know the starting point, treatment becomes much more targeted. One common mistake is telling patients to simply avoid grocery stores until they feel better. Avoidance may reduce symptoms short term, but it does not rebuild tolerance. The opposite mistake is pushing them too hard. If the patient goes into a store, symptoms spike, and they are wiped out for the rest of the day, that was probably too much. Start with lower demand environments. That may mean a smaller store, off-peak hours, a short list, quiet aisles, or even just walking into the store for a few minutes and leaving before symptoms escalate too far. Then progress one variable at a time in rehab. Increase duration, increase busyness, add more scanning, add more head turns, increase walking speed, move from quiet environments to visually complex ones. Eventually progress back toward their normal environments as they improve, and when needed, reduce unnecessary input early on. A hat or sunglasses may help with light sensitivity. A short list can reduce cognitive load. Going with another person may reduce stress and decision-making demand. But those supports should be used strategically, not as permanent crutches. The goal is to help patients move from avoidance to normal function. So when a patient says, I get dizzy in grocery stores, do not treat that as a vague complaint. Treat it as clinically meaningful information. It tells you their nervous system may be struggling with real-world sensory integration. And that is exactly where a systems-based concussion rehab approach matters. If you want to improve your clinical reasoning for patients with concussion, our comprehensive concussion rehabilitation course walks you through assessment and treatment for the system after a concussion. There is a link for the course in the description below. You can also download the free concussion symptom checklist using the link in the description below to help identify symptom patterns and guide better clinical decision making. Because helping patients recover is not just about reducing symptoms in the clinic, it's about helping them return to real life. See you in the next one.